I'd like to welcome Dr. Joe Raffetto, who is the incoming president for the American Venous Forum. Dr. Raffetto is the chief at the Boston Veterans Administration. And can you tell us a little bit about your new vision, your new ideas for the upcoming year during your presidency for the American Venous Forum?
Sure. Thank you, Neil. Thanks for this kind invitation. And the AVF has really been at the forefront of venous lymphatic research and education and patient care. And I think you go back to the core values. And when you start looking at that with the values and the innovation that we have, the education that we have, the scientific community that we have, and the research that we perform, that the AVF is really a group of individuals that wants to promote the better health for patients with venous and lymphatic disorders. And in all of our clinical experiences, we all see these patients on a daily basis. And it is something that the AVF has been promoting now for since I've been a member since 1999, and I've just seen it grow. So I think, in moving forward, we have to continue that vision and actually bring it to reality and continue to work on it so that we can actually make the care for patients with venous disorders and find cures. That I think is probably one of the hardest things to say because curing venous disease is probably way in the future, but certainly you have to have that vision that it's possible. So I want to look at education. I want to promote our younger generation that's coming, bring them up to a level where they understand the relevant and important literature that they should know, and also continue to promote their aspirations towards becoming complete venous surgeons and venous medical physicians. So I also want to, I think our committees that we have are really critical in bringing together and coordinating many of the events that the American Venous Forum is doing. The research, we have so many, the research, the membership, all the various committees, the website committee, and we have incredible webinars. And I think we have to just continue in that path to reach out as many individuals as possible so that when you bring collaboration together, you really start bringing together the venous community, not just throughout our regions or national, but also, of course, international. I think that's where we have to continue our movement.
I actually want to highlight some of the things that you talked about. You've been one of the pioneers in venous research for decades, and you and your lab have been really cracking down on trying to look at venous disease from the pathophysiologic and translating that into the clinical arena. Can you comment a little bit about some of the activities that you foresee for the research aspect, which is one of the core values, as you said, for the American Venous Forum?
Sure. I think that's a very important aspect because, there was a recent research meeting that was completed earlier in the last year. And one of the key aspects when they looked at the different priorities was actually basic science research, because the fundamentals of basic science research will then lead to the translational components that are required to actually apply what we've learned from the scientific lab. And that's kind of like where much of my work is to have a better understanding of the mechanisms, whether it's varicose veins, whether it's venous leg ulcers, why do some heal, why don't some others, why don't they heal? So those are things that we have to understand in a better, deeper understanding so that we can find better therapies. The basic science really is critical at the foundation so that it will guide us in directions where we can actually have better treatments and hopefully outcomes that are very favorable, as well as obviously we're looking for cures. I'll never forget when Dr. Meissner asked me, Joe, will we ever have a cure for venous leg ulcers? And this was about 10 years ago. And I was very optimistic. I said, I think we will eventually. But I know that we have to do a lot more work in the area. And I think bringing the basic science with the translational science as well as the clinical sciences together, we can come up with really important questions and priorities so that we can find a way to improve our outcomes for patients with venous disease, reduce recurrences, and heal ulcers, and many other aspects of venous disease.
Is also very important. You had a longstanding relations internationally, and you have a lot of different connections worldwide. How do you foresee your international connections, your international experience, um, to help push the ball forward in collaboration, not
Mhm.
just nationally, but across the pond, across into Latin America, et cetera.
Yeah, obviously we have a great international committee, uh, and we have various chairs for that. Dr. Bashar is the current chair, and I think that one of the things is that we promote that, and it's, I think, believe it started several years ago, probably even a little bit longer, where we brought together the Villavicencio and the International Committee to make it one forum. And I actually have moderated that session. I think it's very important because there's a lot of research that in other countries, what they see may be different pathologies, may have different ideas and how to approach the problems. So that community is critical because when we start bringing together the international community from different aspects of the globe, we really start looking at a vision where now you have unity and you have global health, and where you can actually apply many of the things that we learned. I mean, a perfect example is, we have different guidelines, whether you're in the United States versus Europe, and we're looking at the same data. So why are we coming up with different guidelines? And then that obviously will affect how we practice and what we do for patients. That you could talk about this for hours in terms of like, whether you're going to do ASVAL or Chiva or do ablations of the axial reflux. And it depends on many factors. It's obviously the data, but it's also what insurance companies will pay. And bringing together the international community, both through the American Venous Forum, through the committees that we have, and also through many of the work that's been done by both the prior chair, Chair Alvaro. He's actually promoted some great webinars, and this is now continued through Dr. Bashar. And I think that has brought together international community. I think they had a very successful recent webinar that was done several weeks ago and brought together many participants, many different countries. And when you start engaging different people, you start getting many different ideas. And I think that's where we have to continue and promote this area of participation nationally, but also as we have said, internationally.
I agree. I think a lot of the guidelines that we have are very focused on Western Europe and the US, whereas other parts of the world may not have access to a lot of the technologies. They may not be insurance, the patients may not be able to afford some of the higher end access that we are privileged to have here in the US with minimally invasive techniques.
Mhm.
And those guidelines, those ideas, those technologies may not be applicable for many, many people who are suffering from venous and lymphatic disease. So I agree with you. I think the international collaboration is amazing. I'm amazed at some of the technologies that we don't have available here in the US that they're talking about. Um, they look really, really exciting, and I'm really anxious to get my hands on some of those tools that they have, and the techniques also. Some of the ideas that they have are really, really exciting to see some of the different ideas that are out there internationally. You've also been a large proponent and a leader in the Veterans Administration. We were briefly mentioning some of your work with the Navy and whatnot. How can we collaborate with the American Venous Forum? It sounds like an opportunity. I'm not exactly certain I know enough to actually explore some of this, but it sounds like there may be some areas where we could work together to try to push the ball forward for common goals.
Yeah, I want to first answer one of your prior sort of concepts that you brought about some of the technologies from other countries. And one of the things that, when you think about some of the things that we have in the United States that other countries don't have, and vice versa, one of the things that I think we have a huge deficit in, and that there is research that supports it, is actually in the pharmaceutical, meaning some of the venoactive drugs and compounds that are available, much more available in Europe, South America, Asia. And we just do not have much of that in our sort of armamentarium. And I think it's where we can actually perform or do a little better in that area, because certainly a lot of patients could benefit, especially the ones that maybe do not want to have an intervention, but they're asking for maybe something that could help them that they can take by mouth. So I think that that's an area that we have to work on a little bit. We have to work on it both from a perspective of science and evidence-based, but it is also something that, we have to work with the insurance companies because some of these medications are not inexpensive. They're quite expensive, and they may not be affordable. They may not be actually covered. And so that really eliminates a lot of individuals that could benefit from some of these veno-active drugs. But going to the other question about Veterans Administration, yeah, there's very good opportunities in the Veterans Administration regarding patients. And patients, we see a fair amount of patients that are elderly, and they have a fair amount of chronic venous disease. In my own clinic, when I see patients, we see probably 50% of our patients that we're seeing in our clinic is wounds, and the majority are venous leg ulcers. Uh, and so we also have advanced venous disease, but we don't have much research in the VA that deals with actual venous work, whether it's thrombotic, whether it's chronic venous disorders. And I think this is where we could collaborate jointly, where we can actually bring together the American Venous Forum that has a lot of expertise and has a lot of experience, and then bring that knowledge and say, why not come together and actually propose a project that can be actually inclusive of the Veterans Administration, because it is a unique population, but I think there's a great opportunity that has not been actually tapped yet that could promote some significant findings. So I agree with you there that we need to do work on that area to bring both our society, and there are many of us in our society, like myself, that are in the Veterans Administration, and we can certainly collaborate with that. I think that's a great thought.
I'm really looking forward to your presidency. You've done an amazing job with the American Venous Forum for decades in research in basic science and translational sciences. Thank you so much for agreeing to this podcast. It was really great.
Thank you, Anil. I greatly appreciate that. And I'm really looking forward to working with all the committees, with the leadership, and really to get to know one of the key things I think is our membership. And having our membership is critical. And, I really want to get to know other people that I've not met yet. And I think where we can promote their interest to be not just participants, but actually to be individuals that want to work with the American Venous Forum in other capacities. I think that's really somewhere that we should also look at very carefully in the near future. Thanks, Daniel. I really greatly appreciate this interview.
Thank you.